One of the most common things I hear about gluten is, well, I don't have digestive issues, so it doesn't bother me. But this myth couldn't be farther from the truth, and today I'm going to explain why. If you're new here, welcome. My name is Bri, and I'm on a mission to help you transform your health and feel your best one step at a time. So a couple weeks ago, I shared a video just talking about how I discovered gluten was impacting my health. This happened postpartum after my first child was born, and that video is linked below. But today I just wanted to do a follow-up talking about all the symptoms of gluten sensitivity that are unrelated to digestion, just to help you identify if there are any red flags that gluten might be damaging your health as well. Because if you're like me, I ate gluten almost every single day for over 30 years and didn't have a clue that so many health issues I was experiencing were actually because of it. So first of all, I just want to emphasize the fact that gluten sensitivity and celiac disease are not the same thing. Celiac disease impacts approximately 1.3% of the population, and by definition, it's an autoimmune reaction to gluten, which actually causes the body to attack itself, resulting in severe digestive trouble and malabsorption of nutrients. It used to impact Northern Europeans the most, but the rate of celiac disease is actually doubling every 15 years. So there's clearly something going on in our environment to trigger this. And now people of all ethnicities are getting diagnosed. Now, non-celiac gluten sensitivity or gluten intolerance impacts a much larger portion of the population, ranging from 40 to 60%. And this is the category that I personally fall into. So if I eat traditional pasta, pizza, or bread, I'm not going to be buckled over in pain or rushing to the toilet with digestive issues. But I will experience more chronic symptoms of inflammation like acne, brain fog, anxiety, painful periods, and these symptoms will just persist all the time. Believe it or not, most symptoms of non-celiac gluten sensitivity actually happen outside of the gut, and only 20% of people experience any IBS symptoms whatsoever. So you're probably wondering, what are the symptoms? And the list that I put together is pretty thorough, but by no means does it include everything. So if you suspect that you have a gluten sensitivity, I definitely recommend doing more research, and I'm going to share some links and resources in the description below. But here are some of the reactions people might experience. Edema, which is water retention, so swollen ankles, puffy cheeks, that sort of thing. Skin rashes, including psoriasis, eczema, and acne, which I mentioned before. Behavioral issues, especially in children. Neuropathy, anxiety and depression. Thyroiditis, delayed growth in children, and short stature. And that's because you're not adequately absorbing nutrients. And I know for myself, I'm only 5'3", both of my parents are taller, and I often wonder if eating gluten every single day of my childhood may have impacted my growth and development, now knowing that I do have a sensitivity to gluten based on testing. There's also bone and joint pain, muscle cramps, numbness or tingling in the hands or feet, anemia, which is iron deficiency, arthritis, migraines and headaches, tooth discoloration, seizures, dementia, and infertility. This is one thing that I wanted to touch on just based on my own experience, because I did struggle with infertility. It took us over 1.5 years to get pregnant, and that included one miscarriage leading up to it. And I was eating gluten every single day at that time, because it wasn't until after my son was born that I made the discovery that I was reacting to gluten. With my second pregnancy, I was completely gluten-free, including for a year leading up to conception, and it happened right away. Now you could say, oh, well, that's a coincidence. But if you just think about it logically, if your body is in a chronic state of constant inflammation, that's not the ideal environment to grow a healthy baby. So it only makes sense that it would make it harder to get pregnant. So you're probably wondering which foods actually contain gluten. Now, the main sources would be wheat, barley, and rye, which are used for most processed foods, including crackers, cereals, pizza, pasta, cakes, you name it, unless, of course, there's a gluten-free label. You don't have to worry about grains like rice, buckwheat, quinoa, or millet because those are all naturally gluten-free. But I would caution you about oats because even though they technically don't have gluten, they're often processed in the same facility as wheat, barley, and rye. So they're usually contaminated. And if you're really sensitive to gluten like I am, or of course if you have celiac disease, you would want to avoid those completely unless they have the certified gluten-free label. So on top of the obvious foods that contain gluten, there are also a number of hidden sources as well. So things like soy sauce, tamari would actually be the gluten-free alternative, imitation crab meat, which is found in California sushi rolls, that also contains gluten. A number of medications and personal care products also use gluten as a filler. So if you're really sensitive, you want to be careful to check those labels as well. Beer, malt vinegar, salad dressings, marinades, they often use wheat as a thickening agent. Trying to think if I've forgotten anything. Some food additives as well. So processed foods are generally your number one source. But once you become familiar, it does get easier to navigate the grocery store. So if you've listened this far, you might still be wondering, should you remove gluten from your diet? And truthfully, I can't answer that question for you. But my best advice is if you're experiencing any of the symptoms that I mentioned, it might be worth digging a little bit deeper. So you might want to start by getting celiac testing from your doctor. It's simple blood work. The only caveat is you can't go gluten-free before that testing because you might get a false negative. So definitely don't remove gluten from your diet before you go that route. If it comes back negative like it did for me, then you might want to try food sensitivity testing. And in my case, gliadin, which is a protein found in gluten, was super elevated. So my naturopath recommended that I remove it from my diet. And honestly, I'm not exaggerating when I say it was life-changing for me. I had been in a chronic state of inflammation my entire life up until that point, and I didn't even know it. It was just my baseline, what I thought was completely normal. And, I recognize that this isn't the same experience for everyone. I am mostly of Northern European descent, and there is a huge genetic component. So, for me, my symptoms and my reaction may have been a lot more severe than other people. But again, if you're experiencing any of these symptoms, you have nothing to lose. You can even forego the testing altogether because you do have to pay out of pocket. In Canada, it's not covered, but just give it a try. My only recommendation would be if you're going to commit to it, try it for at least 1 to 2 months because it does take that length of time to significantly reduce the inflammation in your body to even notice a difference. So commit to it for that length of time, see how you feel, and then go from there. Like I said, you have nothing to lose, so much to gain. And if you want to learn more, please check out my video from a couple weeks ago. I talk about specifically why gluten causes inflammation in the body and how I made the discovery that I was reacting to it myself. It was a long journey postpartum, but it resulted in me making this huge life transformation, and now I get to share it with everyone else. So anyway, thank you for watching, and I hope to see you in the next video.